Chris Jordan, County Commissioner, Commissioner District 1.
Monica Blakowski-May, representing healthcare providers.
Maureen Rosette, representing tribal communities.
Ann Pittsnoggle, Recording Secretary.
Michelle Fossum, Legal Counsel.
Liz Henry, representing the Kalispell Tribe.
Wonderful. I think Commissioner Cuny is on county business. We have some county bonds to sell, so she is busy today. So I think we have definitely have a quorum. Thanks for everyone for being here today. And we'll start. The next item is number 3, citizen input. And we have one person signed up, John Hancock. So John, if you'll come up here to the mic, and I think you gave us some of your testimony. Wonderful. Welcome. And we have a 3-minute timer that'll count down for you.
Okay.
Thank you.
I live on the West Plains near Airway Heights. I have PFAS in my blood, in my well water, and in Deep Creek behind my house. I'm the founder and the president of the West Plains Water Coalition, a member of the Restoration Advisory Board at Fairchild, and a member of county's PFAS task force. I'm here to ask for your support for a PFAS public health emergency declaration. There are 4 parts. We ask board action to, number 1, encourage the local health officer to declare a PFAS public health emergency. Number 2, encourage the local health officer to advance PFAS awareness and professional education for health care providers and systems in addition to citizen messaging. Number 3, authorize and direct SRHD to find and apply for additional funding for PFAS health services. And number 4, include PFAS in your legislative agendas. And I just picked up that piece of paper this morning when I arrived. This is right on the money. I appreciate everybody who's had a role in writing this. I think it's terrific. Dr. V has helped us in small ways for the last 2 years. He needs your support to take this brave step forward. That's what we ask of you. And we've also proposed this to the County Commission and to the City Council. Everybody together towards shared rescue energies. The county task force is just getting started, but with $7 million in state funding for filters, we can accomplish a lot. He's the co-chair of that work, and I say it's progressing well. At the state level, about PFAS, DOH doesn't talk about what they don't do. That's the key here. What they don't do for 1 million of us in Washington is private well protection. That's because private wells are exempt from the federal Clean Drinking Water Act. Y'all are on city water getting a federal subsidy through the Washington DOH Office of Drinking Water. The rest of us don't get either protection or help. That's about 4,000 West Plains families, an estimated half with PFAS above legal limits. We don't know yet which half exactly. That's the point of the health declaration, to wake up everybody. Universal testing has not yet been funded. Some families can afford $350 for a self-test. Many others can't, or they don't understand their health risk. Fairchild and EPA have together tested about 900 homes, and that data has been helpful but not yet summarized or coordinated. PFAS is equally dangerous for the homes tested and untested, and for people aware and unaware. It's not like the danger of smoking. Nobody chooses to drink bad water. An emergency declaration is warranted, in our view, to wake up all the people and all the agencies and to qualify and discover all possible sources of funding. Thanks very much for your interest, and I'm glad to answer any questions that you have for as long as it takes, and it's forever. Thank you.
Thank you. Thank you, Mr. Hancock. I appreciate Dr. Velasquez's participation in the PFAS task force. We just spoke last week, and he's really doing a lot of great work researching ways to connect better with residents, make sure they know more about the health impacts. And I know we need to keep working towards more funding for testing, definitely. So thank you, Mr. Hancock, for coming today. And just a note that in your packet, there was a few other written comments at the beginning of the packet here that were received. Just a note for the board. And chair report. Time's been flying by. I guess we haven't had a meeting since the end of October, but we've been really busy. And a couple things to report. We had two committee meetings of the Transition Committee, which consists of Maureen, Dr. Blakowski-May, myself, Commissioner Cuney, and Dr. V, Mr. Byrne, Kim, and who did I forget? Oh, and Mr. Cathcart. Sorry, it's a long list. I was doing it from memory. Okay, we had two meetings, and you're going to hear more today on the agenda about, we both reviewed the position, the SRHD Administrative Officer position description, and we have some suggested changes to bring forward to you today for consideration. And we also reviewed the proposals that came in for companies that would help us with the search process. And so there was a lot of proposals, so we had a lot of scoring to do. And I just remembered I didn't bring my scoring sheets, so I owe those to Carrie. But we did scoring, and we have information that we'll be sharing about next steps today on that. So that was a lot. We probably could have even had another meeting. So I really appreciate all the time that HR and the team has put into this. So we'll discuss some of those items later on the agenda. And then the budget, let's see here. I missed the executive committee meeting, but there was discussion on all these items to bring forth today. As you can see, we're going to consider adopting our 2026 legislative agenda for the state. We also are working on a federal agenda, which we'll talk about today. And let's see here. We do need to touch base on item 7D you'll see on your agenda. We need to really nail down the recruitment timeline. And so we'll talk about some important dates coming up in January. And then, that is for our members, our appointed members. If you can't believe it, Patricia, you've already been here 2 years on the board. So we're up. We have every 2 years, we review the members that we appoint that are not tribal or elected. And so we will have a process that we need to talk about in January to look at applications for those positions. And so we'll nail down some dates for that. Whew, so there's been a lot going on. And then I know, let me just briefly talk about the Budget and Finance Committee. And really, it was just approving the voucher and financial reports to come to the agenda. And then there was a treatment services report that's also on today's agenda. So Mr. Cathcart, I think there was a Policy Education Committee meeting. I'll let you report on that.
Yeah, thank you. We did have a meeting a couple weeks ago to talk about the federal agenda, and we kind of worked off of the draft that staff had provided us. I don't think there were a ton of edits in that meeting. I think there's been a few since, but in that discussion, we had decided there was a goal, I think, from this board that we would try to get this passed at this meeting. But in the discussions, we kind of agreed, and I think legal had the thought as well, that it really should be 2 touches. And so we will have, I think, a follow-up meeting after this to take in any input from board members. And we will go through that federal agenda here later on in the meeting. But and I do want to make sure I apologize, because I know that there was at least one board member, Maureen, who wanted to sit in on that, and it did not get, and I'll take ownership of that not getting out to for you to be invited. So we will make sure that happens at the next, and figure out a better method of ensuring that board members who want to observe or participate where they can have the ability to do so. So I do apologize on that. At that same meeting, we also, I think, just buttoned up the legislative agenda, which is what is before us here under our action item A. And of course, we could go through that very quickly at that time as well. So that's what I got for now. But it's been a real nice, I think, easygoing process, and I've appreciated all of the input from the participants. Dr. May, you've been in those as well, so I really appreciate it.
And so I think it's good to have another touch because there was I sent some suggestions in because I did ask Anne just to send it out to the full board so everyone could see the draft. So we'll set up another meeting and then make sure folks, if they have edits or suggestions, can attend as long as we don't have a board quorum. Okay. Does that sound okay to you? Both of you?
Yes.
Legally and administratively? Great, thank you. Okay, well then let's get right into our first item here at number 5 for the board, the executive session. And do you want to state the purpose and how long we plan to be in exec session?
Sure, so I'm going to start at the bottom of the agenda. The first reason is labor negotiation guidance pursuant to RCW 4230-140 sub 4. And for that item, it will be the board members, myself, Rayburn, Danielle Stoddard from HR, and Kim Kramars. And then we will have reviewing performance of a public employee pursuant to RCW 4230-110-1G, and litigation, potential litigation pursuant to RCW 4230-110-1I. And for those items, it'll be the board and legal counsel and Mr. Brown. So I anticipate we'll need a total of 15 minutes. That's what I'm told.
Oh, 15?
I know,
Wow.
that's what I'm told.
5
Goal.
minutes per item, okay. We're gonna hold you to that.
Pressure.
Okay, we will break then for this executive session. Thank you. We'll be back in open session here. And next on the agenda is number 6, our consent agenda, which has our meeting minutes from October 30th, 2025, vouchers from the month of October 2025, and a contract with Sayer and Fossum. So I'll look for a motion on the consent agenda.
So moved. I'll second.
Okay, any discussion on the motion?
I have a question.
Sure, Maureen.
On the contract with Sayer, there's no like top, like maximum amount. Is there like unlimited money for attorney's fees? Unless I missed it. I did go pretty fast.
I can maybe speak to that. It's billed in 6-minute increments on a monthly basis. And
I understand that I'm an attorney. I'm saying, is there a maximum amount that you can, for the year?
not to my knowledge, no.
So we have unlimited money for attorney's fees?
No, we have in the budget a budgeted amount, and actually, Kim, maybe you can answer. We did discuss this during the budgeting process this year, and actually, if I remember correctly, we've generally been under. And so did we actually reduce the amount? I can't remember. I know we discussed it as a potential change in the budget because we were looking for every area where we have been over budgeting and underspending.
Correct. I think this is on. So we have, in addition to Sayer and Fossum, we've also contracted with other attorneys with employment law for assistance. So overall, we have a line item for legal in our budget for the year. And we looked at an average of the past 3 and updated our budget to reflect that. However, if there is circumstances that make us need to spend more than that or go over, we would talk to the board about using unassigned reserves. But we do have a budgeted annually based on historic. I'm sorry, I don't have the number in front of me. I think it's around 300,000.
So yes, we don't have an up to amount, but we have a budgeted, we do have a budget, and it would come back to the board if we needed to go over that budget, correct? Okay. Okay. All right, any other questions or comments on the motion? Okay, seeing none, all in favor say aye.
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 Any opposed? Okay, motion carries unanimously. And we'll go to 7A. This is the resolution adopting the Board of Health legislative agenda for the 2026 State of Washington legislative session.
Do we want to, are you going to present the details?
No.
Okay.
No, I'm just kidding. I don't know how many of you are familiar with the process, but over the last several months, we've worked together internally first and then with the board committee to put together the printed legislative ask that you all see before you. And so today, after many months of working with the board members and with internal staff, we are asking for an adoption of the Board of Health legislative agenda for the 2026 State of Washington legislative session. And that's resolution number 2509.
Do you want to give some highlights of maybe some new things that were added or any changes since the last meeting? I noticed I had suggested maintaining current foundational public health
Yeah.
services as kind of the first thing, because that's kind of vital to, we already took some cuts and I know they're discussing even pulling back more because of lower revenues at the state from different sources. And so anyway, I appreciate you guys putting that in front and top of mind. So when we do, any of the board members, if we interact with our legislators, we can really hammer down, please, no more cuts for the foundational public health services. So thanks for putting that in.
Yeah, and Lola, if there's some specifics that, because I'm trying to remember exactly what's new versus kind of a carryover.
Food permit was.
But yeah, the food permit is the big new one, I guess I would say. I think everything else is a variation of things, probably written in a little bit different way than they have in the past. We tried to simplify and be a little bit more, I think, specific to certain things in certain areas and a little bit broader in some others. But I think the biggest change is just sort of the headings and the organization and how we are trying to present the information to both electeds as well as the community. But yeah, the change on food permit enforcement, which really is trying to get more enforcement authority on that topic for the health district, is one of those. But is there anything else, Lola, that's really a change from previous?
I think, we are always looking at our workforce. But I think a couple of changes here is also we are focusing on first responders as part of that community of health. We are focusing, like we did in previous years, on primary care and rural provider recruitment. But we also kind of highlighted this year a little bit more the training and education for individuals that are providing care or first responders, and also enhancing behavioral health training for those individuals. And then beyond that, we're always looking at supporting the health of our youth. The protection of children from dangerous opioid and fentanyl exposure is something that we've listed in multiple years, but this year we've also gone into trying to enhance the school and community partnerships.
Yeah, I think it really does expand on the fentanyl pieces. It adds the PFAS language, which matches similarly to language being used in the city, in the city's legislative agenda. And then it also reemphasizes, as we did last year, the need to attract a stronger workforce, and has some bullets around that topic. But generally, I can answer any other questions if folks have them, but it's laid out pretty well, I think. And I want to thank Lola for the work and also the team behind her helping to shape all this together.
I noticed that I think it is a lot more concise and
Yeah.
less wordy, and I think it's really easy to read.
That was my goal,
Yeah.
just getting there.
Dr. Blaikowski-May, did you have a?
Yeah, I just, one comment, thank you also for all the work. I know it took a lot of iterations, and so appreciate the time it takes to wordsmith all of this stuff. So appreciated the opportunity to reflect. And I wanted to also highlight that PFAS part of it, because we had the community concern that was brought to us earlier in the meeting, and I think it's great that it's reflected specifically in the legislative agenda.
I think that looks great. Did you pull that from your city, some of the bullets from the city agenda?
Yeah, I think it's slightly tweaked, but it's more or less what's in the city.
Yeah, actually, we might want to look at, with our state agenda that we're finalizing at the county. Anyway, if we needed to
Yeah.
use any of that, we did get funding, as was noted by Mr. Hancock, this last year for these filtration systems. So now we've got to figure out how to help people get those installed and find the right type of technology that works. And so we're hoping at the county to get that going, and then maybe go back to the legislature for more funding once we can show some good results there. So this is great that we're all in alignment on
Yes.
the PFAS issue. All right. Any other comments or questions?
No.
If I could request, Lola, once we get to January and all the bills are starting to be introduced and all that, can you, when you present your list to us, can you kind of peg, if each of these priorities for us has a bill that is kind of closely aligned or associated with it? I think that would be kind of nice for us to kind of track that each year. Yeah, because I know every year, we don't always get everything we want, but it would also be nice to know, did we even get a bill introduced that would have associated with those two? So I think that'd be kind of just sorry to add another layer
No,
on there for you.
No, it
Something
completely
like
makes
that.
sense. So that's
Okay.
great. Yeah.
Just a question about how is this presented to state legislators? Like, do they just get this in the mail? How's that work? You go there and present it to them? How does it work?
So we as the district, we do not present that because that might look like lobbying. We can educate. What we do is we build these so that our commissioners and any organizations such as Wasalfo that's actually representing the community can take these forward and use them as educational materials that they can share.
And just to be clear though, you can, these are all statements of support. They're not actually tied to any particular. So I think that's the nuance. You can definitely educate and advocate on everything on this. I mean, the board members can do whatever we want. Staff can educate and advocate, but when it gets to a specific bill, then they cannot particularly, advocate for that particular piece of legislation. Am I correct?
Yeah, there are restrictions against the extent to which this board can lobby or a specific bill.
So do those restrictions, would those apply to, I mean, not to the commissioners, because we can be advocating on the behalf, but what about appointed board members or tribal community members on this board?
I think in their individual capacity they just can't represent
Right,
as the board.
got it. And we talked about, actually, didn't we just talk about at the last meeting, maybe you doing a little training for us?
Yes.
So let's see if we can get that set up, even if it's just if we set up a web training where you zoomed in and any of the board members that wanted to participate, that would probably be worthwhile. Is that how you were envisioning it?
I am open to whatever's going to work the best for all of you. So I can do it that way and people can zoom in if they want to. I can come here and do a presentation, whatever is the board's preference.
My preference personally would be to have it during this meeting, if that could be succinct enough and not distract from the regular business of the board. But this, for me, is going to be the easiest time to be able to absorb that and all hear it at the same time.
All right, yes,
I
Commissioner Jordan.
agree. At the time we're all scheduled to be here, it'd be good to do it in a meeting.
We'll be about 3 weeks into the session at our January meeting, so that might be good timing. All right, so in our individual capacity, but we cannot represent that we are supporting a bill on behalf of the health district. Yes, okay. But it's a good statement of where our priorities are. And then WASALFO, Washington State Local Public Health Officials, is a advocacy lobbying organization that can lobby on these things on behalf of all the agencies and communities.
Yes, and so we will then start joining them regularly on a monthly meeting, which we kind of talk about, and then as this starts to roll forward, it will be weekly, and they provide updates. We all LHJs provide our asks to them so that they can see, the direction that we're going, and often we see this same message kind of replicated across, and they will continue to go up. I think we even have a group that will go to Washington on Hill Day, which
I joined them last year, yes.
Yeah.
I got to meet all these folks from different public health agencies in Washington. That was great.
Yeah.
So I know last year you asked if anyone wanted to get those updates from WASALFO forwarded, and you were forwarding them to me, I think to other board members, so that you can get those updates, and they talk about all the specific bills, and then you will, on a monthly basis, give us updates here at the board meeting. And I like the idea of just keeping them in these categories so we can kind of keep them organized.
Okay.
All right?
Easy enough. I mean, we've got it already outlined for us. We can just add it to our outline, so that's lovely.
Thank you. Thank you, Lola. Thank you, Councilmember Cathcart.
Yeah, well, I'll just make a motion to adopt Resolution 25-09.
Second?
Okay, we have a motion and a second to adopt item 7A. Any further discussion, comments? Okay, all in favor, please say aye. Any opposed? Okay, I think we've unanimously approved our Board of Health legislative agenda for 2026. So onward and upward. Off we go. All right, item 7B. And this is regarding, as I mentioned earlier, the recruitment firm to recruit candidates for the SRHD administrative officer position. So let me get to the tab here.
Commissioner Walder.
Oh, wait, where is the tab?
It
I
is in
believe
the
it's under
packet
7C.
that we have.
Oh, there we go. This is the special packet. So how do you want me to proceed with just kind of reporting out from the committee, and maybe Carrie can help me out if I miss something on the process that we went through and kind of some of the recommendations. Okay, so if you open up this large document, you can see these are all the firms that applied. Each transition committee member scored individually each firm, and then we had a total score at the bottom. And we had, let's see here. At the bottom, you can see the results is we had 3 firms that were over 500 points, or in the top 3. And two of these firms have worked with us before. Is that true, or just one? 2 of them have previously worked with us.
Correct, that would be Raftellus and Raffet and Associates.
So let's see here. Those are the 3. If in your packet, you'll see the proposals from those 3 top organizations, businesses. And we scored them based on the information that was presented to them. So it was, if you see here, evaluation criteria on your request for proposal, experience, their narrative and how they would go about the recruitment. They had to provide at least 5 references of past searches and people who we could contact, and then their financial responsibility and their fee. So we had those 4 areas, and that was a lot to go through. But we ended up with these 3 top companies, and what the discussion we had as a committee was that, what if we were to move forward with putting out the job announcement and doing recruitment through our own HR office to start for the position, because we already have a position description that we're going to talk about today on the agenda. We've already done a lot of work. We already have updated recently the position description and have gone through a search process before. So a lot of the firms had like several months of finding out what you're looking for, talking about the position description. And we're like, well, we already are probably at step 3 out of 5, right? So we don't necessarily need to pay for all of that. And I don't want to pay for it. So one proposal that came out of the committee is that we do authorize staff to move forward with starting to negotiate a contract with at least the first firm, but cutting down the time frame, trying to reduce the cost, because we're already at step 3 of 5, and most of them started at step 1. So, but in the meantime, advertise the position with the updated description as adopted by the board today, whatever we adopt today, and then see in January where we are with recruitment by a certain deadline. And if we have some candidates that have applied that are meeting our criteria for review by the transition committee, we may not need the search firm. But today we thought, what if we brought forward an authorization for staff to at least start negotiating with the first, the highest scoring on the list, so that at the point in, early to mid-January, if we don't feel like we're having enough applicants that are meeting our criteria, we could enter into the contract, and then they could start helping us out at that point. So am I explaining everything good there, Ray? You're looking at me like, okay, Amber, you got it. But
Yes.
yes, good. So basically having this in our back pocket to be able to enter into a contract at in January if need be. But if we end up with a pretty good candidate pool that we can just internally with HR go through ourselves, we could save some money and time. And we did do some research. Kim, were you the one? Someone did research with Kim. Kim did research with two other counties that had recent searches, and they just did them internally, and they filled the positions successfully without having to go to an outside firm for help here in Washington State. So two other counties that are, similar size, maybe a little smaller. So that's kind of the thought process. And so today, this item would be if we wanted to authorize the starting to enter into a contract, but then holding on actually signing any contract and bringing that back before the board. And if we don't need to sign it, then we don't need to. But really starting with the first firm that got the highest score, and then if they don't want to meet our criteria or can't meet our time frame or our cost estimates, then we go to the next firm. So that's why we brought 3 forward, so that, if they don't want to be flexible or meet our terms, because they just proposed. Now you get into the nitty gritty of what we need in our time frame. So we're really just asking for authorization for the HR to move forward with the contract negotiations with firm number 1, and then move to 2 or 3, but hold on any signing of that until a certain date. Do we
Yeah,
need to set that kind of time frame, Ray, do you think?
I think it would be nice. I can give you a little bit of an update. So we started advertising a week ago Friday. Currently, we have 17 apps. We've received 17 apps. We have not started screening them yet. So after the position description finalization and any other guidance that the board gives, we'll get that into the system, and then we'll start screening off of that. I believe Ann is working on a transition team meeting for this coming Monday, which then could give us more guidance on that. So, so I think if we have timelines, that certainly helps us. If we're shooting for, like you say, first week in January, to have the final evaluation of where we're going with this, that certainly would be helpful.
Ray, real quick, when you advertised for this, was it a local search, or did you guys throw it out regionally, nationally? What do we have those 17?
So that they're currently advertising from within house, but it's on a national, regional and national platform. So we're using LinkedIn and a lot of the same search engines that these firms would still use. So we are reaching out nationally. I know several of the applications are from out of state. The majority of them are from either local or within the state. So I don't know any. I haven't looked at the applications myself. So
That's just been 1 week so far.
yes, about a week, and it'll be 2 weeks tomorrow.
So I'm just looking for advice from staff around, what do you think is a reasonable kind of cutoff when we would, if the transition committee can start to meet next week and start to, is that what you were looking at, Anne?
Commissioner Cooney, the chair of the committee, had asked for next week. Her available time was between 8 and 11:30 on that day. And so that she was looking for that to do the screening criteria, and then another meeting in the first week of January to review the position, or excuse me, the applicants.
Ms. Rosette?
On the position description, did you send out the one that we had, or the original one? Not with the, changing the, I know we changed the experience and stuff, our preferred or required and stuff. Did it go out with the changes, or as it was originally written?
Yeah, that was also my question too. Yeah.
No,
Yeah, so we had a debate. Obviously, we couldn't change the description without the full board's approval. So if we decided, let's get out the old job description, at least to get it out, and then when the board updates it, we'll put the new updated on the platform and maybe highlight, I suggested highlighting at the top, change, updated job description or something in, with a yellow or something so that people would maybe look at it differently. So yes, we wanted to get going because we're like, well, let's get going. So, yes, Councilmember Cathcart.
Yeah, and I think assuming we adopt the changes to the position description, I think assuming we filter out some of these folks to move forward, potentially we want to let them know, I assume, that the position has some edits to the description that they originally applied to. Would it be too late if we said at the time of our executive committee in January that if we don't feel that we have a substantial enough pool or what have you, that's when the staff authorization would, in theory, take effect to hire the firm, I mean?
So that would be the 15th of January?
That sounds about right.
Is that when we have, yeah, I think.
That is correct for the date.
Just throwing that out there as a potential day that we could set a deadline.
But staff can't sign a contract until this board has seen the contract and approved it. Because
But contingent, I mean, can't we pass it today, contingent certain things?
but you're going to have to see the actual contract as it gets negotiated and written
Oh,
up.
because we don't have the contract
We
yet.
don't have a
Okay,
contract to look
okay.
at.
But in terms of the authorization, okay, so they would move forward regardless, but we would maybe peg the date that we would as a board, I guess, then. So it would just have to be our board meeting, right? That's really the only option.
Well, we can always call a special meeting
Yeah.
if we needed to, even a virtual meeting. But I mean, does January 15th seem like that's when the executive committee would meet? And we can kind of get a status update from the transition committee, because you and I are both on that. So we could say, okay, this is where we're at. And if we wanted to, if we're dissatisfied with the candidate pool, then within a week or two, we could approve a contract, right, with a search firm, depending on when we call the meeting.
Correct, yeah.
Okay.
And meanwhile,
Is that-
negotiations would be happening so that we'd have something for you to look at the January meeting. And
And in between, we'd have a meeting this next week, hopefully, to make sure we understand our selection criteria and, in order to make it to the next round, so to speak. And then have another meeting in January to look at the pool of candidates. So there'd be work happening for the next month.
Yeah.
That seems reasonable. I don't know. What do you think, Dr. Bykowski?
I
Is
just
that
have a
enough time in your experience to get a good candidate pool? when
Yeah,
you're-
I mean, I'm pretty impressed that there's that many already.
Well, we
Of
don't
course-
know if they meet any of our criteria.
Of course, that's true. There's a lot of movement happening in the industries everywhere right now. Did I miss it? Is there like a closing date for the posting? Usually when we put something out there, there's a posting date and then there's a closing date, and then at that time, it's published in there. This is when the applications close. And then at that time, you gather all of them and have a chance to review them. Did I miss the closing date or do
So-
we not?
no, we do have a closing date. So currently, our system doesn't allow us to post it publicly, open until filled. We can put that in the language, but we had to put a closing date. So currently, the closing date is December 31st. Now, we can at any point extend that, but currently that's what it is. And it's advertised, I believe, as open until filled, but in the system, the closing date is December 31st.
So I'm just thinking of working backwards. I think the executive committee would want to know from the transition committee that there's enough qualified applicants to be able to really narrow down. So maybe the closing date, so the transition committee probably needs to meet and make a recommendation to the executive committee about whether to move forward with the contract or not. So like a week. So we probably want to even aim for like one of the first 2 weeks of January, but we'd have to have the closing date in order to, do you see what I mean? We want a closing date and then a transition committee meeting to review all the applicants and then a report back about whether or not we need to go out for the search or not. further search with a support.
The transition committee would probably want to come together by the 9th of January, I would think, if we wanted to be deliberative about this at our exec meeting the following week. And that would give a week or so for then the transition committee maybe to review.
It's
meet.
going to take a while to look through.
Yeah.
HR is going to have to look through after they know the selection kind of criteria.
Cool.
So yeah, I'm fine with that. I think we should try that. That gives us a couple weeks in January to meet, see about our candidate pool, make a recommendation to decide if we need to enter into a contract or not. Okay.
But still keeping the January 15th date to decide if we want to go with somebody or not.
Right, that would be when the executive committee, I think reporting back to the executive committee, because the executive committee will need to know if we need to set up a special meeting or do something to get that contract signed. Because we wouldn't want to wait too long. If we're not getting good quality candidates, we want to get into a contract as soon as possible and not waste, additional weeks. So,
Yeah, and with the guidance of the transition team, we can easily extend that date out. We chose that date just because we had to put something in.
Right.
So that gave us about a month and
well,
a
let's
half.
keep it that date for now. And then
Okay.
does that give you enough guidance for helping to set up meetings for the transition committee?
It does, and it's in alignment with Commissioner Cooney, who wanted to have a transition committee meeting that first week of January.
Okay. As long as staff have time to review and get us the information that we need.
I think they should be able to review as they come in and
Yeah.
screen.
Okay, sounds good. All right, so what is the action that we need to take then
So
today?
just quick question on do you want us to go ahead and start negotiating with the top firm? Just see if they can negotiate that down in the interim? Do you want us to do that same negotiation with the other two in case that we don't see any movement in that first one? I just need clarification on that.
My biggest concern about the top three all had good references and excellent products that they showed us, right? I felt like the price point was too high on all of them because they were looking at a much broader time frame and search than what we need. And so I would authorize I think we should authorize you to start talking with them, starting with one and then going to two or going to three if needed, to really shrink down the scope and the cost. And so I guess it will be informing to know, with the first firm, are they willing to shrink their cost or not? Or the scope. If they're not, then we go to firm number two. Does that make sense? So you're looking for us to make what would the motion be then, Michelle? It's basically authorizing staff to start the contract negotiations with starting with the three firms, starting with the first scored firm.
Yeah, the high scoring.
And perhaps it's in consultation with the transition committee that they would then move on to number 2 or 3 if that's what's needed.
Right. That sounds like a great motion. Do we want to restate that? Okay. So we're looking for a motion to authorize staff to start negotiations with the highest scoring firm, going down to the second and the third highest in terms of recruitment of candidates for the administrative officer position, and to follow up with the transition committee with information on the negotiations. So, sorry, that was my attempt at restating the motion. I don't know if it was any better. So authorizing staff to start negotiations with the highest scoring applicant, and then following up with the transition committee to get our feedback on next steps.
Do we need something in the motion about giving the transition committee any authority to make any decisions on whether they need to jump to the second or the third or anything? I'm just making sure we have everything in that
Yeah.
motion that needs to be there. So there's not some got to go back to the full board. Is there any type of authority that we need to give to the transition committee to make any types of decisions that you can foresee?
No, I think the motion that allows staff to move from the highest scoring to the second highest scoring is what we need, because the transition committee doesn't make decisions. They make recommendations to this board.
Then I'll second the motion as stated by Commissioner Waldron.
Okay. Oh, am I allowed? I guess I am allowed to make a motion. I don't, maybe you should make the motion.
I will make the motion as stated by Commissioner
There we go.
Waldron.
I'll second.
Okay. All right. So the motion is, again, staff can start negotiating with the top 3 firms, going down in order of scoring, and giving recommendations to, getting feedback from the transition committee on preparing a contract that could be entered into if decided upon by the board. Any further discussion on that? Okay, all in favor say aye.
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 Any opposed? Whew, okay, we got through that one. 7C, and this is the position description and salary range that Ms. Rosette was just speaking to. And so, let's see here. If you open up to your 7C in your packet, you can see the red line changes that the transition committee is suggesting to the job description. The major change in my mind is on page 3, which is the required experience versus the preferred qualifications. So I'm trying to see if we got everything in there. So the main change was we moved it from 12 to 10 years for a minimum number of years of progressive executive management experience in health or business related fields. So that was a major change there. And other members of the committee could explain kind of why we suggested that. And then I'll just go down to preferred qualifications. We prefer that there be 10 years in public health, but that's not a requirement. And then the valid driver's license is something that Michelle can speak to. We spoke about some new guidelines about having a driver's license and driving. So you can speak to that, Michelle, because I think you brought that forward. So, Ms. Rosette, did you want to talk about how we came to those changes?
No.
Okay. You were there.
I was there, but actually, I had a question.
Yes.
Because I thought we had discussed changing the education from a master's to a bachelor's and moving that to the preferred education. I thought that, but am I incorrect on that?
I thought we also discussed that. So I wonder if we missed that. That's why as I was reading, I'm like, did we capture everything in here?
Because I was looking at it, because I thought when I said I thought we'd have a broader pool because of the bachelor's versus the master's, but I don't know how much it would change now. But I'm just saying that's why I thought we would have a much broader pool with the bachelor's and then the preferred as the master's.
I do remember that. I believe that we had talked about bachelor's as required and then it could be master's as preferred. I'm also wondering if the required and the preferred experiences kind of need to be flipped a little bit. Seems like we're allowing for more variable in the required and more specificity in the preferred. I'm just thinking that needs to maybe flip.
I think that's why we did that variable in there, was to get a broader pool of people in the door. And then we made it preferred to get to narrow it down.
Right, but I think in the preferred, we're saying 10 years progressive executive management experience in public health, including it's, ... but required, we're allowing for health or business related or in a mid to large size professional. So we're allowing for a lot more in what's required versus what's preferred. So I feel like they need to be flipped, but at the end of the day, it probably doesn't matter. Okay. Okay. No, I understand. It just seems like it would make more sense to have more varied, but it doesn't matter. It's not a big deal.
Charlie, when I called you to just let you know about what was on the meeting agenda this week, you had, I know you have a lot of experience in government and veteran services and the military with, searching for different people with different qualifications. What are your thoughts on the master's versus bachelor's? Because we could put that out there. I just wonder, are we going to end up though, like wanting to hire someone with a master's degree, and so we can put it out there, but in the end, we're going to give more points in the process to people with a master's. So anyway, it's just a question.
Oh, well, so look, I believe in a lot of experience versus, I take the master's and the PhD to a high level, but I believe also in experience. So what I had mentioned before was, yeah, I don't mind opening or agreeing to having the required education as a bachelor's degree, but I've seen positions before in where if we want to open up to the bachelor's degree, we go bachelor's degree, 12 to 13 years of experience, master's with 10 years of experience, PhD, 8 years of experience. So it gives it so that the education piece is not just put to the side. We still want experience, but give some credit to the amount of time that somebody has put in for schooling. So bachelor's, 12 years experience, master's, 10 years experience, PhD, 8 years of experience. Because I'm sorry, if somebody has a PhD, they've already been working in this field and has invested more of their time to actually get more education, and they already have much more than 8 years of experience. I also do believe that even though this is a leadership role, and it says business related fields, I do believe that the preferred experience of having somebody with public health or some kind of health care background is going to significantly help here, because I don't want somebody to come to the table and get lost in terminology with the other big wigs that are on it, So, sorry, the big people, the big people table. So the preferred experience is good, public health or healthcare setting. But then when it comes down to the education, we could just put that caveat of the different steps.
I think sometimes exactly what you're saying. I think sometimes I've seen it referenced. They'll have the years, education, and work experience, or say or combination of both.
Yes,
kind of something like that. Yeah.
So it could be bachelor's and 12 years.
Yeah.
Master's and 10.
Yeah.
PhD and
That's the second line of that.
Right.
Ray, were you going to say something? Oh, no.
Yeah. So under our current system, we do give credit for master's and PhD. So equivalent of 2 years for master and then 4 years for PhD. So
Yeah, but
if you set the years of experience for required at 10 years, then we would require 8 years. So that's already built into how we do practice now. So I don't know that we would need to make an adjustment here. I know in conversations with the committee, the reason we did lower that down to 10 years was to try and bring more into the pool.
Except for if we want to bring more people into the pool. If I'm looking for a position and I see that it's a master's degree and I don't have a master's degree, it's not my LinkedIn is gonna just kick it out or something in that nature. And where if it has a bachelor's, I could be like, well, I have a bachelor's. Oh, hey, I got 12 years experience, I can apply. But if the required says master's degree, that's gonna kick it automatically. So actually putting it in here would help us get more individuals in our pool and could save us a lot more money on trying to get this, because then we can do it locally. Yeah, that plus the fact that the firms are only going to first look for master's and PhD level, and they're not going to look at bachelor's levels.
Yeah, and I know the transition team had that conversation about removing the master's requirement. So I think that would be a decision at the board now. If you want to do that, we can do that and then put it under the preferred. So then that does open that pool up. Like,
Right. Because the
So-
preferred education right now is blank. So we could say, hey, bachelor's 12, master's 10, PhD thing, but then preferred education, master's or PhD. But we could still open it up to the bachelor's because that's the requirement. Preferred, we want a master's and a PhD.
Yeah.
The part about required licensure certification seems discriminatory to me. The valid motor vehicle license and current auto insurance, there are people who are disabled that may not drive and could apply for this position. So it seems like it should say either that shouldn't be there, or it should say that people with disabilities are exempt from that requirement or something like that.
If I could, I think on that, I somewhat agree. I mean, I don't know that we have to require the driver's license and auto insurance, but I think we should be able and need to insist that they have some kind of transportation option that will get them where they need to go on time, et cetera. I don't know the verbiage on how we want to put that, but I would agree on that aspect.
Like reliable transportation.
Yeah, I
something
mean,
like that,
if
yeah.
they want to Uber everywhere, that's their choice.
And that's the question I had in that last page here where it says must be able to travel as required with or without accommodations. ADA, I mean, what's the accommodations we're looking at here?
That was a conversation we had with, I can't remember who it was, but we had quite a discussion about it because we had to make sure it was legal for people that like maybe were blind or whatever. So I think that's what we were referring to there, was like somebody that's blind that needed, well, I don't know what accommodations they need, but
Right.
I'm saying that we were trying to include everybody versus exclude.
Okay.
But Michelle, you were the one that had, I think it was Michelle, am I remembering? You had some
Yep. I had-
experience with this or what you should or should not require.
Yeah, I had concerns because somebody who is disabled may not have a driver's license, but they can still travel as required. They may have an ID and travel. So, and I think staff were trying to pick that up by adding that with or without accommodation on the last page. But I didn't see it initially, and another applicant may not. So maybe we need to rework that. Well, first, I think under required, it's kind of duplicative. So take it out of that one. Under required licensure, leave it as preferred. And maybe put with or without accommodation behind that, or
Yeah.
valid identification.
Or just say reliable transportation. Preferred, reliable transportation certification or licensure.
I like the one at the bottom, that says ability to operate a vehicle multiple sites in a timely manner.
Right.
That gives you the option of not having to drive the license.
Yes.
If you go out and just if it moves the car out, we get there.
And then that would be consistent.
Well, then that means on the second page, then we would also have to look at the red one down here. It says responsible for driving between multiple work locations. Driving may take place at any time during scheduled works. So we might need to reword that by saying, reliable transportation, timely, reliable transportation to meetings, events, stuff in that nature.
I think it's still important to have valid identification because you can't take a plane without valid ID, so.
Right.
Yeah.
Okay. So
I hope you're capturing all of this.
I'm trying.
Thank you, Michelle.
So just kind of going through on the, I guess it's the third page, under required licensure, we're going to put in there valid identification. And then under preferred licensure, you put driver's license and auto insurance or other.
Otherwise, access multiple sites in a timely manner.
Yeah.
Maybe instead of timely manner, I would just say on time. I mean, you can get somewhere in a timely manner, doesn't mean you're on time. That's right. That's right. Yeah.
Do you know from experience?
You also need
Oh,
to go back, you need to go to page 2 where it says responsible for driving between multiple work locations. That's in red, so we'll have to do the same kind of verbiage there.
Fix that as well. Responsible for I'm not coming up with the right word. I'm going to put transporting in for the moment. Transporting between multiple work locations. We need to travel, to attend conferences, etc. There's really no obligation to drive. Okay. And then the under typical work environment on page 3, I think those bottom 2 are okay. Our bottom last one, and then the second one on the last page. Be able to travel is required with or without accommodations. I think that's fine.
Okay, so it looks like we've kind of cleaned up all the travel and transportation and ID.
Yep.
So then we just need to get back up to the required education experience piece and make any edits there. And then I think we're very close.
So again, under our current hiring practice, we do now allow the 2 years for the master's as well as for the PhD. So I guess I would rather not create a precedence by putting that language into the PD if it's common practice now, but that's up to the board on how you want to do that.
Wait, I have a question. Are we gonna put bachelor's degree in though? Okay. I'm
Yeah,
fine
so-
if it's already built in, I'm fine with that. I don't know, I feel like that makes sense. Kind of what you were saying, Charlie. What you said is that it's already added into the point system, it sounds like, right?
Yes, that's
would we
common
want-
practice
So would
within
we
the
want to
agency
keep
now.
it at 12 years though in the text for a bachelor's?
And that's why I was going to say to put in the PD, because if we do required education of a bachelor's degree involving major studies in public health, blah, 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 and then the required experience is a minimum of 10 years, then we don't, if we do 12 years of experience with a bachelor's, well then, with a master's, we could do other things. That's just the way I see. I mean, I've seen it in a PD before on LinkedIn and all that stuff. I know that it's written in the points, but it gives more information to the applicant to be like, I can apply for this position because if I'm a bachelor's experience, if I have a master's program, I mean, yeah, that's just I don't know what I'm saying,
So I-
but you guys know.
So I think what we could do is we could say bachelor's up above, right, under required. Then we could say a minimum of 12 years. And then down below, you say preferred education, master's or PhD. Or do you want to just say master's? I mean, obviously with PhD, if you come in with that, you're going to get more year credit, right, under the practice.
Correct. So you can define it if you wish.
So master's, probably just say master's. So then what you're saying, Ray, just to be clear, is if someone did apply with a master's and they met all the other qualifications, we'd only require 10 years of progressive. And if they had a PhD, it would be 8. Okay. So we don't need, okay, sounds good. So that's what I'm proposing, that we change it then to bachelor's degree as required, go back up to 12 years. What about the other changes? Is everyone okay with the executive management in health or business related fields? Is that?
Yeah, I'm good with that.
And then down below, preferred education would be master's degree. And then we just don't put in the preferred experience. Is that right? Or no, the preferred experience is in maybe we don't put do we need to put 10 years there, Ray, or not? Because you're saying we're already going to give them 2 years with a master's. So we can just say progressive executive management experience, just keep it generic? Or is that really what we're looking for?
No, I feel like it would still
10 years.
say 10 because you're already giving them the 2 years.
Okay.
Yeah.
So I feel
Got
like
it.
keep it like
Okay.
that.
Perfect.
And it is preferred, that
Right.
language at that point,
Right.
so I think that gives us
Okay.
more flex.
So 10 years of progressive executive management experience in public health.
But adding the master's level to the preferred education.
Right. Got it. Okay, and we already made changes to the valid ID there. Yes, Commissioner Jordan.
Question, not to make it more complicated, would it be repetitive to say health, public health, or business related, or not? I get that health could be read as a broader term, but it also could be viewed as medical versus public health. So just a thought to
So you're
put-
saying repeat what we had up above, but add in public health.
Well, up above, it doesn't have, we're scratching off public and just keeping health on there. So in the preferred, I believe, Chris, what you're trying to say is put experience in public health or health settings or health management. Am I right, sir?
or business
Or
related.
business related, yeah.
Just to be clear, it could be any of those. Don't know if that's helpful or not.
I think that does broaden it.
Yeah.
Because public health is kind of a separate entity
Then health administration.
than health,
Yeah.
which is broad.
So would it be public health, comma, health, or would you say health management, health care?
Just health,
Health.
comma,
All right.
public health, and
Leave it broad.
Yeah.
can live
Health,
with that.
public health, and business related.
Or business related
Yeah.
fields. Okay.
Yeah.
Be good.
Yeah.
Did we get that change? So basically copying what's up above, but adding public health as a preferred.
Exactly.
Right. Public health, comma, health, or business.
Just for clarity, Commissioner Jordan, you were talking about in the required experience.
Yes,
Yes.
I was.
Yeah, that's what I was saying too. Yeah.
Yep.
Yeah, not the.
Oh,
preferred.
I'm sorry.
Under the required is what he was talking about.
Yeah.
That makes sense.
So maybe I'm the only one that's not following.
Yeah, I was looking at required experience where it was crossing out public health and thinking it might be better to put health, public health, or business
We
related.
could do it for both. Required and preferred.
Could be both.
Because we say
Health,
or. We
public
have
health,
or, so we're
and
good.
business.
Yes.
Yeah.
Yeah, for both.
Sorry,
Preferred
now I
and
get it. Now I
required.
understand.
I
what you're
think,
saying.
yes, let's just mimic the main language on both of them, making the years different is all. So they say the same thing, basically, only one is 12 years, the other one's 10 years, and they should say the same things.
Okay, sounds good. All right, I'm just looking over at Michelle and Ann to make sure they have all of our changes. It's always so fun to wordsmith in a board meeting. We're almost there. We're almost there. We're doing pretty good here. I think this is good. We're making it better. We're going to get a bigger pool, and then we can have criteria to narrow that down, so.
Just to clarify something, so under the requirement, I know the discussion earlier was if we're going to add the health in there, it would read years of progressive executive management experience in health, public health, or business related. Then under preference, the preference for the discussion during the committee was to have that in public health. But the minimum requirement would be in health, public health, or business. So I think under the preferred, it probably should remain as public health.
Yeah, I think
again,
that was our
yeah,
discussion.
That
You're
makes
right.
sense.
Yeah,
You're right.
So keeping the preferred the way it is, but just adding public health to the required experience. That makes sense.
Correct.
thanks, Ray. Somebody remembered what we talked about.
Thank you for bringing it in.
And I'm sorry, I didn't notice, I looked at other pieces of the packet, but I kind of skipped over this one because I was like, oh, I was at that meeting. But I probably should have looked at it a little more closely because we could have altered some of these ahead of time. Sorry about that.
One clarification under required experience, are we leaving that at 10? Because,
No, 12.
12, okay. We just want to make sure that, because we had different things. And then under preferred, if there's a master's, it's 10 years.
And we just had a conversation. Did you catch what I know you guys were talking. So under preferred experience, 10 years of progressive executive management in public health. So leave it the same. Don't make any other changes to that one.
Okay.
But then in the required, it was a minimum of 12 years of progressive executive management experience in public health, health, or business-related fields.
There you go.
Woo!
Under preferred?
Because it's no, under required.
Under
Yes,
required. Okay.
And in addition to that, under the required, the first part where it says master's degree, that'll change to bachelor's degree with the 12 years of experience.
Right.
Got it. The masters will come out. And so can I get that language under required experience just one more time? Minimum of 12 years progressive executive management
In
experience.
public health, health, or business-related fields. So we're saying there's an or, so you can show us that you have that type of executive experience in any of those areas.
Got it.
And we're requiring that. I think that right, that's what it's, because it's an or. So if you have 10 years in a healthcare related, you'd still meet the requirement, or 12 for a bachelor's. Anyway. Okay, have we thoroughly confused? And do we want to read through the changes, or do we trust that I think I know all the changes. I think we got all the driver's license stuff figured out. We know we are open to people traveling to any necessary meetings on time in any way that they can get there. And we want them to have a valid ID, though, for other travel purposes. And the other pieces I think we just went through with the required education, experience, and preferred. I think we're good. I can review with you after the meeting just to make sure that we have the corrections. But I think we're good.
I'm sorry, can I just bring up one other thing?
Oh gosh, no.
Michelle. So
Tricia.
if they are driving their own vehicle, do we need to specify that they need valid identification if they're taking their own vehicle while they're doing business for the health district? Or does that matter?
So my thought on that was to say valid driver's license and current auto insurance, or valid ID and otherwise the ability to access sites on time. Is what I had in my mind. So, I mean, because if you're going to drive, you have to have a license and insurance.
Okay. Woo! Okay, so I'm looking for a motion to adopt the new updated position description for the administrative officer with the changes identified today.
I'll make that motion.
And I'll second that motion.
Okay, any further discussion? Going once, going twice. Okay, all in favor say aye.
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 Any opposed? Thank you. I appreciate all the really good input. That was excellent. Okay, so then we're on the, oh, yes, Ray.
Yeah, the second part of that was also confirming the salary range.
Oh, sorry. Did we have that in the document here, or I just missed it? Sorry, I was just looking through the red lines. Where is the salary range in our packet?
Yeah. What's
So I don't remember, I'm sorry. I know we were gonna look at it and review it, but I don't remember we made a specific recommendation.
I think we did. He showed us a bunch of different areas, and we went with the one that was between 200 and something and some. I remember it. And we agreed on if it's 284. I remember that we talked about it.
And in the job
Yes.
description, are we gonna leave it at salary range 284 to make it like whatever, or are we actually gonna put the salary range in the PD when we put this out?
So I believe the salary range that's listed here is what's consistent with what the last advertisement was. We can confirm that. So if we want to take that salary range out, we can put that in after the fact. But the range that was advertised last time was 145,000 to 2.25. 2.25. And that's what the transition team had agreed to move forward, was with that same salary range.
Okay, do we want to is that,
I guess I thought we went a little higher than the last one based on some other. I might be confused, but I thought we were higher than that 145. I thought it was like in the 154 bottom range.
If I may, I was in the transition meeting also. We did compare, we looked at another job posting at another LHJ for a similar position. And that one was, we were at 145 to 225. And that one was 154 to, I think, 218. So I think that was what you're thinking of. So we felt that our 145 to 225 is probably appropriate.
Yeah.
it's still in that same range, basically? Okay.
Yeah, and the other position that was hired was with Snohomish, so on the west side, so cost of living is a little bit higher over there. So I think competitive wise, we're right there.
All right, so do I need to ask for a motion to approve the salary range? Can we restate the salary range for the record? Can someone help me with that, Ray?
So 145,000 to 2.25, 225,000.
Wait, what was the lower number?
145,000.
Okay, so looking for a motion to approve that to go out in the advertisement.
Just a question, is that reflected in the 284 salary range that's in the description?
I don't have the salary schedule with me. If you want, we can remove that and just, I
Well, I was just
believe
gonna
it
say,
is.
if it is, then we probably don't even need a motion because we approved this and it specifies that salary range. So that's why I was asking.
Without seeing the salary schedule, I can't confirm that.
Okay.
Not on the actual salary schedule because it's a contracted position.
Okay.
So it's just a placeholder within our accounting or HR system, if you will. But it's based on the contract.
And so then if we approve now, then instead of saying 284, it'll be the range on there,
we can-
advertised.
Yeah.
Okay.
We could do that too.
So
But
move
there is a
to
salary
add
step for this position.
145,000 to 225,000 in the salary range.
Thank you. Do I have a second?
I'll second. Everybody's looking at.
Okay, any further discussion on the motion? Seeing none, all in favor say aye.
Aye.
Any opposed? Okay, we've unanimously approved the salary range as presented. And now we'll move on to the recruitment process. So hopefully we can move through this pretty quickly. Anne has laid out in your packet 7D the proposed recruitment timeline. And as we've already mentioned, today we're looking to approve the timeline. We can start the process tomorrow, update the announcement, all of those things. And to Councilmember Cathcart's point, let applicants know of the new description.
Is this D?
And then, I'm sorry, I'm just looking ahead. So you're just putting on here, this isn't the transition committee dates, though. This is other dates, and
This is for the board members that their terms are
Oh.
ending.
sorry. We're recruiting lots of different people. Okay, sorry. This is our appointed member recruitment timeline. So we're going to look at approving it today and then announcing that these positions, we have 3 appointed member positions. So like we did last time, we would announce all of this, socialize it, get the information out. And then interview questions would be sent to board members for edits from the past, from 2 years ago. And then the deadline you're proposing, Anne, would be Thursday, January 15th. Is that just because it coincides with our executive committee meeting, or that's just?
That's
date.
just arbitrary.
Okay.
It's just trying to allow as many days as possible for the opening. And then to allow time for staff to process, we have to do a debarment check on each of the applicants before they can come before the board.
Okay. So then you're doing those checks the following week. And then we need to have what we need to decide today is number one, a date of a 1-hour special board meeting where we finalize the interview questions and select the candidates for interviews. And then number two, we hold a virtual meeting for those who are new to the board. We hold a virtual meeting where we interview the top selected candidates for each position. So we narrow down the selection and then we interview folks for each of the 3 positions who the folks that are in those positions have been in those interviews. So we need to have a 1-hour special board meeting. What are you suggesting in terms of the week? And that next week? Oh.
I wonder, could we simply allow the interviewers to identify a date at a later point? Do we have to decide a date today?
Except for
But
the
not
appointed members.
The appointed members, right.
So it's all the commissioners and our tribal community members that get, right? Or no, not is it the tribe? Do they also participate?
Yeah,
Sorry, we're in new territory.
We are, the WAC, for those that want to know, I'm looking at 246-90-0206 is all applicants for non-elected positions shall be interviewed in a panel format by the local Board of Health, subject to the following. And then it talks about the types of questions and things like that. So, interviewed in a panel by the local Board of Health.
And then number 3 isn't up to us, though. That's up to the commissioners, correct?
I'm sorry, what's up to the commission?
Number 3?
Well, no, this is when we would select candidates to bring to the county commissioners, right?
Yeah, make a recommendation
Yeah.
to
So
the
that'll
commissioners,
be-
so the commissioners appoint.
The board can also do that directly after
At
the
that
interviews
number
in the
2,
4-hour
we
meeting.
could just do that
Okay.
at the end of that meeting.
Yeah, previously, the virtual 1-hour meeting was held on a Monday for like an hour to select the candidates moving forward and then the questions, finalizing the questions. And then that same week, before the regular board meeting, they had a 4-hour virtual meeting to do the interviews. And then everybody arrived in person for the board meeting and then selected who would move forward for recommendation to the Board of County Commissioners.
But we could do that virtually. We don't have to be in person, right?
Correct. You, at the 4-hour interview, the board can decide at that time who they would like to select to move forward, or they can wait for another regular
can
board
choose,
meeting to make that decision.
And 4 hours sounds really long, but really, there's usually a top 2, 3, I can't remember exactly. We choose, we can choose as a board how many people to move forward for the interview. And let's say 3 or 4 people per position. It's like about 45 minutes, and then there's time for discussion, and then you maybe take a little break, and you move on to the next position, interview 3 people, have some discussion. So that's kind of how that's why it seems really long, but you get breaks in there, and there's interviews and discussion time. So, so you're looking at a Monday? What dates are you suggesting, Anne?
I believe we had some conflicts with
Yeah,
the
Monday.
Monday.
It can't be a Monday
Oh,
for my
right.
schedule. Yeah.
And then
City Council.
I've been trying to work with the board members to find a time, but it appears that you, Commissioner Waldorf, and Commissioner Cooney are not available the last week.
Someone
in
got called to
January.
jury duty, so I can't guarantee when or where I will be that week, unfortunately, the last week of January.
So if possible, the recommendation would be to hold it the week before the board meeting. The applications could go out on the 16th, and then the board can meet anywhere from between Tuesday and Friday to hold the 1-hour and a 4-hour meeting.
So January 20th, so January 19th is Martin Luther King Jr. holiday, right?
Correct.
Am I reading that? Okay. So you're thinking something between Tuesday and Friday that week?
Correct.
Okay. I know Tuesdays, the Board of Commissioners are pretty packed, but we're just looking for an hour, right, to narrow down the candidates. What is the best time for the longer meeting? Because Commissioner Jordan, we've talked about going to Olympia that week. Because I can't guarantee that I can go to the fly-in the next week because I am on jury duty. So,
What about that Wednesday?
yeah. What do you think we could accommodate, Commissioner Kearns, a 1 hour lunchtime Zoom to do on the Tuesday, the 20th, to narrow down the candidate list?
You've seen how our Tuesday meetings work.
I was just looking for.
I don't think we can guarantee that.
So what if it was later in the day, like, because I know Dr. Blakowski may. Oh wait, you're not. We're trying to get the schedules of our other members. What if it was later on a Tuesday, like 3:30 or 4 or something like that?
Possibly.
But then we have to give notice to the people to know that they need to. Would we tell folks that this is the interview time up front so that they would know they had to be available for that time? We could do that.
Yes, we can do that.
Okay. So like, let's say we call somebody by 5 p.m. on Tuesday and say, you're getting interviewed on Wednesday at noon. They would already know that the interview time was between noon and 4 or something. Okay. Well, what about late afternoon on that Tuesday, the 20th?
I can do Tuesday. I just have a conflict at 5:30 that day, but before I can make it work.
Liz, I got a thumbs up from Maureen. Thumbs up. Okay, so like,
Do you think we could do a noon and then just do executive sessions in the afternoon if we needed to on the Tuesday? Gives a little more time.
is there a preference?
80% of us are on this board. We
Yeah.
can just tell Matt.
Sorry, no can do.
Exactly, so get kicked to the.
So
evening.
would you
I
guys
guess we
prefer
could-
lunchtime or later in the day? Does it matter?
I'm open as long as it's before 5:30.
Do you have a preference? No. Okay. So like a lunchtime versus a 3:30 or 4 is either way. So what do you want to do?
I vote for lunchtime.
Okay. So noon to 1. Okay. And then virtual. Yeah.
And we'll be provided copies of the applications, you say, on the 16th. So we'll have over the weekend to review them. Hopefully we can just bust through that meeting, right?
That is correct.
Okay.
So can you get those to us like when is the closing date? The 15th. So you can get them to us early on the 16th, do you think?
It depends on how many applicants we receive and how long it takes to run each through the department check.
Okay.
So we could probably have it to you, I would say, by time we close at 12:30 on Friday.
Oh,
If that would work.
Because you guys close early on Friday. Okay. Yeah, that would be great because it'd be nice to be able to look at those before the long weekend. So, okay. And then what about the 21st for the longer meeting? Do we have any conflicts with other boards and commissions?
I'm open between 11 and 3.
I can't get my calendar to move here. Okay. Yeah, I'm open on that day. So I'm flexible. That's a good day. 11, so does that work? 11 to 3, is that what
Yeah.
you said? 11 to 3. And we hope Commissioner Cuny will be able to join. I know that she'll be able to make the Tuesday to help us narrow it down. So, I mean, if there's a board member that is absent for whatever reason, we just move forward, right? I mean, we don't have to have everybody there. But I know everyone will want to participate. Okay, so we just need a motion then with those new dates and times, which you'll send out to remind us, Anne. We just need a motion to approve the member recruitment timeline that we just developed with the dates that we've entered for the first and the second, dates and times, for the 1 hour board meeting and the 4 hour board meeting, and authorization for staff to begin the application process. So looking for the motion.
So moved.
I'll second.
Okay, any concerns or questions? All in favor say aye.
Aye.
Any opposed? All right. Woo. So item number 7E, this is a follow-up from a year ago when we were doing a feasibility study for the opioid treatment program, our treatment services program, about whether we should, the feasibility was to whether we could continue to support the program, or would it be more feasible to look at other providers doing the opioid treatment program. And there was lots of conversations and lots of meetings, and also just a lot of information about our treatment program, which we, the board decided to table that feasibility study, step one decision, until December of this year. So this has been tabled for 1 year. And so the choices are to, I guess from my perspective, oh, Commissioner, did you already have
Well, I was
an
just
idea?
going to suggest an indefinite deferral,
Okay,
and I'll make that motion if,
okay, go ahead.
all right. I will so move a indefinite deferral of item 7E.
Second.
I have a question.
Yes,
Was there-
questions and comments on the motion?
Was there a feasibility study, or was it just the saying that you were thinking of a feasibility study?
There was a two-step process, and I think we mostly went through step one, but we did not go any further because, and we can go back and get you that information. So I don't want to incorrectly describe the process, but we did a lot of community meetings. We looked at the budget and tried to dig deeper into the opioid treatment program to understand their feasibility to continue to operate within the health district. And then, you know, with the opioid crisis and a lot of things happening, it didn't seem like a good time to make any changes to that program. And so that's why we tabled the decision for a year, if that's fair.
Yeah, and I would just say, I think the idea was there's a couple phases to it, as Commissioner Waldrop said, and the administrative officer at the time was doing the work to see, okay, is this possible? And we kind of got to the end of that phase, and we were in the time period of deciding, okay, do we move on to a second phase where we're going to actually start potentially seeking out groups that might take this on? And it was at that point, and I think for differing reasons, some still not enough information, some just timing, as Commissioner Waldrop said, it was decided to punt that about a year, and here we are, and I don't see us revisiting it at this moment in time, certainly, maybe years from now, but not now, so.
And what we did ask was that we did want to be more engaged in knowing more about what the opioid treatment program is doing. And so we've had that's why we have monthly updates. And I know there's, you guys are sitting over there waiting to give us an update. We asked that we wanted to be more engaged. We wanted to make sure there was a spotlight on the program so that it can be, we wanted it to be in the black. We wanted to be successful in reaching as many clients as possible. So that's why we created that dashboard, and we've asked the staff to come back. Well, they created the dashboard. Thank you. And we asked them to come back each month to give us updates on the statistics so that we know how that program is doing. And hopefully it's, and then we made a choice this year to put more funding into the program, to hire and increase the hours to see if we could serve more clients. So that's kind of a quick history. All right. So there was a motion and a second to defer indefinitely a treatment services feasibility step one decision. Did I get that correct? Okay, any other discussion on the motion? Oh, Patricia?
Yeah, I think it would be reasonable to consider, instead of doing it indefinitely, I think maybe we should take another look once we have an idea if the increase in funding, the increased hours, all of these things are actually working and seem profitable. You know, it seems like maybe giving it another year and coming back and discussing might be worthwhile.
I
don't
do
know.
think that when we made the decision to put funding into expansion, we actually gave a timeline for that, for a follow-up. Was it a year? So I do think we made that as part of the motion when we put that funding. So does that, I mean,
Yeah,
so we
that's-
are going to get an update.
That satisfies it to me
Okay.
because I didn't particularly like all of the problems that we had over the term privatization. And I thought that the original motion maybe could have been written differently, so.
So part of the motion that was made last year too, was to ask that treatment services come in with the monthly updates and then more in-depth on a quarterly basis. Do we think, should we just scale that back to a quarterly update rather than having the monthly? I think they're in a position now where, we could relax that back to quarterly.
The only exception I would say is as some of the expansion stuff is happening, I think it'd be good to get updates on that piece
Yeah,
specifically.
if there's something important, I mean,
yeah.
certainly don't wait till the next quarter. I mean, certainly tell us, but I mean, having that required monthly update, I don't know if that's necessarily needed at this time anymore.
We put a lot of time into working with the program leadership to really identify the stats that we wanted to see. And I think I agree with you, Commissioner Kearns. So
I don't. I think actually it might be beneficial just to have a written update provided where they don't have to come and present every time.
that would be a good,
You know,
that
just
could
a
be a
brief
compromise.
written report
So
to
it's to
us.
keep getting the statistics each month, but
Yeah.
but
They don't have to come and say, yeah.
do we need to just make that as, can we amend the motion to, or does it have to be part of this motion? Okay, so we'll take action on this motion and then do we want to, we can decide if we want to give that guidance in a motion. So we'll take, looking for a vote on the motion on the floor, which is to indefinitely defer the decision on the treatment services feasibility study. So looking for a vote, all in favor say aye.
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 I
Any opposed?
I'm gonna abstain.
Okay. All right, so we have one abstention, the rest are ayes for the record. And then do we want to make a motion on, changing the update process from treatment services?
The monthly report in our reports, but they don't have to come and read. But have them come in on a quarterly basis? They'll come in a quarterly basis, but
Yeah, so moved.
Good job, Charlie.
And second.
Okay, does that seem like we're being clear for you guys? Okay, awesome. Well, and of course, we want updates on the expansion, which I know you'll give, or the interim directors can give those updates as well. So, okay, any discussion on the motion? All in favor say aye.
Aye.
Any opposed? Okay, unanimously approved that motion. Thank you. That's a great idea. All right, election of the 2026 board chair. So it's coming to the end of my board term.
Oh my gosh.
So I am looking for, I can't believe it. It's been a long year. I'm looking for any motions from the floor on electing the 2026 board chair. Do I have a motion?
I'll move to appoint Councilman Michael Cathcart as the 2026 board chair.
Okay. Any discussion on the motion? Are you willing to serve? Oh, yes, Marie.
I will.
Of course I was. How do you determine, like, how does this go? Does it just get volleyed between commissioners? Is that how it works? I'm just curious how it's like.
he's vice chair.
Commissioner,
vice chair.
I mean, sometimes, but not all of them.
Traditional.
Yes, if there's other motions, we can
I'm
take them.
non-traditional.
from-
I'm just
from the
I'm
floor.
just curious if that's the way things go. I'm not saying.
It can be anybody from the board that can be elected. It doesn't have to be, I'm pretty sure unless the RCW changed. Anyone can be, yeah, yes. So yes, anyone can be elected to one of the officers of the board. And so if there are any other motions, we'll take those. Okay, so we have a motion and a second to appoint Councilmember Cathcart as the 2026 Board Chair. All in favor say aye.
Aye.
Any opposed? Okay, well, welcome.
Thank you.
I guess I get to
26.
also do the election of the vice chair. And then do you want me to hand it over or just continue with the rest of the meeting?
I think historically, we've like handed the gavel.
Okay,
Okay. All right.
2026, so.
it is for 2026, so it's up to everybody.
You're welcome to finish out the
Okay, I'll finish the meeting up and then he gets the gavel and once the clock strikes midnight of
There you go.
December 31st. Okay, so vice chair, and is there anyone who wants to make a motion on our vice chair for next year? Commissioner Councilmember Cathcart, I'm so used to saying commissioner now.
Yeah, I will nominate Commissioner Jordan.
I will second the motion.
Very interesting.
Is there any other, so when we're doing this, do we take other motions or do we have to vote on each motion? I just want to make sure for future that I'm doing the process correctly.
Right, I can't think of a time when we've had more than one person that,
I know in some
Wanted to do
cases
it.
you can do a thing where you have a slate of candidates. Or, there's other ways, but just checking. Okay. Well, Commissioner Jordan, are you willing to serve?
Oh, I'm not someone who's good at saying no, but I'm not sure if this is a friendly motion or not.
It's meant entirely friendly, so.
We'll make it work.
Okay, so that really means maybe send you up for chair, but not for 2 more years. But maybe. You don't have to. It's not necessary. But well, that would be great to have your I think having a newer person be involved in the leadership would be good. And I know Commissioner Cooney's or Commissioner Kearns will be then stepping off the executive committee because you'll no longer be past chair. Okay. All right. Well, is there any discussion on the motion? All in favor say aye.
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 Oh, fine.
Any opposed? Okay, Commissioner Jordan, welcome to the role of vice chair in 2026. Okay, wonderful. So let's go through our, how are we doing on time with everybody? I know.
Yeah.
Is there a way we could briefly look at the federal agenda before people have to leave? Or do we want to just have anybody get the information out about the next policy committee meeting and then people can send in their input, within a certain time and process? I don't know if we don't want to wordsmith it today, but I would just direct you to look at it. And then we have some stuff in there around CDC, specific funding streams from the federal government. There's some stuff in there about SAMHSA and behavioral health, and a section around drinking water and PFAS again. So thanks to the work so far. Oh, yes, Lola.
So the very first portion of this ties back to the FPHS funds and looks at it from the federal level. All other segments in there, which there are 3, really tie back to the other portions of our state. And I think at this point, I think we had some discussion around potentially adding language for the childhood immunizations programs and a few other things. But if you all would be willing to look at the legislative draft that's currently in your packets and provide me with feedback, I know that we do have the plan to set up another meeting just at the first of the year. Is that correct, Councilman?
Yeah, we got to figure out the date that will work on that, but yes, there will be another meeting coming up.
So I would just recommend that you resend it out, maybe in a format that's easier to do, lined edits, because this is great. I mean, when we get the final desktop edited document, it's great, but it's easier to suggest comments, in a Word document or something like that.
And we already have that prepared, so I can get that
Okay.
out to everybody.
So I would suggest sending out to everyone, and then once the Policy and Education Committee meeting has been established, I'm guessing January sometime, then making sure everyone knows about that meeting and a deadline for any comments to get sent to the committee to review. And then those who want to attend the committee, you just need to let Ann know so we don't have a quorum of people, right, at the committee meeting. Does that work?
That works.
Okay. All right, thanks. So we checked that one off. And then let's start with Ray. Any big updates from the administrative side of the house?
Just a couple things. One, typically we do kudos every quarter, which I do have 3 to read, but then a quick update on the WIC too. So we do have, I mentioned last time that with the continuing resolution being passed, that funds the WIC program through September of 26. So even though the continuing.
It does. Okay.
It does.
So some programs were funded through the fiscal federal year.
Correct.
Just a few.
WIC. We know of WIC.
Yay. Okay.
Yes.
I want to ask you about any others.
Yeah. So that was flatlined, but it is funded through September of 2026. So we don't have the contract yet, but we have received the number through an email. So that should match the contract. So we're in good shape there.
Excellent. Well, do we want to, Dr. V, I feel like we're always shorting your time, and I would love to know, do you want to give the kudos?
Correct.
Let's get the kudos.
Yeah. So if I could just we have 3 kudos. If I could just quickly read those, then we could acknowledge staff on that.
Yeah.
So the first one comes from for Martin Kelladrum and Ryan Musgrave, and
Do
they
you have
are.
do you have a photo for them up there?
Oh, yes. Sorry. Maybe. And
You can tell us about our
okay,
wonderful staff.
she's on her way.
Oh, it's in, it's in.
Yeah, I
it's
believe
in-
the
it's in
packet does have it, but we can.
In 7 or 8A, part of the packet. Yes. Yeah. Oh, that's fun. Yay.
There we go. So these are members of our maintenance team up at 8th Avenue. The kudos is the WIC team needed a wall painted in a very tight timeline. With planned vacations, we were running into challenges meeting that deadline. A quick call to Martin and Ryan changed everything. They immediately stepped in to support the maintenance team and get the wall painted. Their willingness to jump in, go above and beyond, and ensure the work was completed on time is greatly appreciated. Thank you, Martin and Ryan, the entire team for your teamwork and dedication. So, great job. So that normally would not fall within them. That would be our maintenance team here that would do that, but we were not available to do that. So thanks to them. So the second one is Amber Gimlin, and she is in our human resource department here at the health district. It says employee badges may seem like a small detail, but they play a big role in our daily experience. They're seen multiple times a day and are a visible part of who we are at work. Amber understands the importance of this and recognizes how something as simple as a badge photo can make a difference in how our employees feel. Amber consistently takes pride in supporting our employees and does it with a smile. Her dedication to our employees matter the most, and this is a perfect example of the care and commitment she brings every day. Thank you, Amber, for going above and beyond to make a difference in our workplace. All right, and the third one, this comes within my division, Environmental Public Health, and so this is for the entire water rec program. And the water rec team is consisted of Eric Meyer, who's the program manager, Tom Binger, Lori Freer, Joe Lucas, Sandy Phillips, and Tricia McClure. Says, thank you to the water recreation team for helping us have a very successful pool season. We see certified pool maintenance managers, that's what CPM stands for, had all our maintenance technicians and assistants go through your early season pool operator and safety seminar, and we are sponsoring some technicians to go through the CPO course as well, certified pool operator course. Please continue to keep us informed when you have extended learning opportunities. Thank you, Norm Murray. So that was from one of the pool operators. So, and just some quick facts on the water rec program. The water rec program protects public health by working with owners and operators of the public and semi-public water recreation facilities to prevent drownings, illnesses, and injuries. Over 400 inspections of water recreation facilities in Spokane County are completed annually for compliance with the regulations. So those would be the state WACs that we enforce. The team also reviews plans for new and remodeled water recreation facilities, responds to facility complaints, and provides trainings in drowning prevention education to operators and the public. So just huge thank you to all three groups for all their work and dedication on that. And then the last thing is, do you want to defer the treatment services report?
Well, we have it in our packet here. Do you want to just come up and just give us a quick update on finances and the expansion? I think that would be, or if there's anything different or new with your monthly, I guess if there's any trends in the monthly numbers that are different, you could point those out to us, but I don't think we have to go through every one.
Okay, so you'll see that there was, again, another deficit for October. However, there was some operational and building expenses that were atypical. So that accounted for approximately $53,000 of expenditures in October that were not typically accounted for. So that would have played a factor there. Additionally, our expansion, sorry. I had a slight injury this morning, so I'm a little off. We've had our expansion positions that have accounted for additional salaries and benefits. So for the month of October, we have seen an increase in salaries and benefits of approximately $28,000 as well. So with that, to that end of the expansion positions, we have all, with the exception of an RN and medical assistant filled, which both of those should be conducting interviews, I believe, this week and next week. So again, fingers crossed, that should be able to be addressed and have those positions filled and working towards being trained.
So Misty, are you not able to expand to the hours until till those positions are filled? Is that the?
Specifically, the dispensing nurse is the key component that we're holding for. We just brought on our expansion nurse practitioner. That position is required in order to do admissions for the expanded hours. So that position just started this week.
So would it be fair to say that you're going to have in the next couple months maybe higher expenses because you've hired all these folks, you're training them, you're getting them going, but you don't have the patients yet to get the revenue?
Correct.
Okay.
I would hope to see, as long as we're able to recruit for those positions and onboard, in theory, by January 1st, that we would be able to start seeing the transition to the expanded hours, we'll say February 1st. If they don't start until January, then it would take that. We want to make sure to give new hires ample time to onboard, learn the program, learn the systems, learn the workflows, and the technological programs as well.
So either looking at February 1st or a little later for the full expansion hours.
Correct.
And then once you know everybody's on board, and then you can start to communicate that out to the community.
Correct.
Okay. So, but we are pulling from that fund though that we set aside, right?
No.
To be able to pay.
No.
Oh, we haven't. Okay.
No. So, real quick, these are where our numbers are at. And I say real quick because that'll actually get to answering your question. Our intakes, dispensing.
Nothing really is standing out as far as the numbers. It's basically what you guys have seen every single month. There's nothing like wildly different. Sure.
Your buprenorphine, the doses dispensed has gone down quite a bit for those. I'm wondering if you understand or have an idea of why that is.
Yeah, so with buprenorphine, again, it doesn't hold individuals that are using fentanyl. It has a ceiling effect. So when someone's using fentanyl, buprenorphine has a ceiling or a cap of how much effectiveness it can have on individuals. And so when they're using fentanyl or significant amounts of other opioids, that buprenorphine doesn't meet that need. And so that's where they may transition over to methadone, or in the event that they've transitioned to another program or they've tapered off, there's that potential as well.
Because of the potency of the fentanyl,
correct.
then the other one, it doesn't appeal to them, so they switch.
Correct.
Basically what you're saying. Thank you.
I have a question. So do these rates of methadone versus buprenorphine use, is it reflective of, in general, other OTP programs where they have, some amount of methadone and some amount of buprenorphine?
Yes, absolutely.
It's the same, very low buprenorphine?
Yes,
and
unless they're
much higher
operating in OBOT, which is an office-based opioid treatment program, in conjunction, which is specifically just the prescription without the requirement of the counseling or the treatment components as well. If they're operating in OBOT, then their Suboxone numbers, or the buprenorphine, are the only things that they could prescribe. They cannot prescribe methadone from that. So an OBOT will have obviously higher numbers of buprenorphine prescriptions.
And we don't do an OBOT because it's just not our program.
Right. It's a separate licensure. It's a separate program, a separate modality.
Does Chaz do that?
Mm-hmm.
Okay, because we were visiting with Chaz and Frontier Behavioral Health, and we got on the topic, and I think they only distribute, right?
Mm-hmm.
They're an OBOT. Okay.
Correct.
Okay. So they wouldn't have methadone that they distribute.
Correct. Not for addiction purposes, no.
Okay.
And then again, numbers for the counseling in the jail with counseling sessions, jail doses, assessments. Okay. Oh, sorry.
So we're not anticipating seeing increases in any of these numbers until the expansion happens.
Not necessarily. We could. We won't have our current staffing seeing increases. There's always the potential for an influx of patient population. The expanded hours won't have that opportunity and to see more patients coming in for utilization of those hours until we have those positions filled.
Are we doing anything at this point to increase patients coming in? Are we doing any additional advertising or outreach or anything else?
Yes. So we actually have SUDP, a counseling position that actually is a community-based position. That individual goes out into our community. She does assessments in the community. We have a community resource coordinator. She actually goes out and meets with community partners and informs them of what we're doing, how we're operating, that we do offer assessments during the entirety of our operating hours. So we do have staff going out there, myself and our associate director, April Pinkney. We are working on a schedule of times to be able to go out and meet with additional partners as well to make sure that they're fully informed and aware of what we can do, how we can help, and finding out what exactly their needs are and how we can be of assistance to them.
Patricia?
A couple other questions. One, it looks like you're using your telehealth counseling sessions quite a bit more. I'm just wondering how that's going. I think telehealth is great. I'm just curious about that. That's the first question. The second one is just checking to see if you looked into the Procure grant at the city of Spokane that's for culturally specific treatment of opioid use disorder, and the grant ends on the 15th of December. So if you haven't looked at that, you might want to look at it. It's for $500,000. And I think since we have new tribal members and also lots of discussion about WIC, there might be some low-hanging fruit for you guys to consider to look at that.
Okay. Absolutely. The telehealth, yes, we have the capacity and our teams have been utilizing it. And with the transition with SAMHSA, our medical team is able to start utilizing some of the telehealth availability as well. So that's helped with making sure that patients are able to adhere and follow through with their appointments as well.
Do you have problems with people, I don't want this to seem like a stereotype, but with people, not having phones or not consistently being able to access telehealth because they have problems accessing computers or telephones or whatever?
Sometimes, but the reality is a lot of our individuals, if they don't have a phone or they lose it or it gets broken, they have access and there's resources in the community where they can obtain a phone in order to have telehealth appointments available and accessible to them. So there are resources, and our teams are very well knowledgeable of where those resources are and how to help facilitate that in the offices with them.
Great.
So.
Thank you.
Yeah. Anything else? And then medical, I want to jump to the next, that's not it. Nope. So what I was hoping to get to, it wasn't on here, was to answer your question about if we're using the dollars that were allocated for the expansion. We are not, because, and Kim, correct me if I'm wrong, but the way that was set up was in the event that at the end of the year, our budget does not account for, or we go beyond what we have generated in our revenue, then we would dip into that dedicated reserve that was set aside for the expansion. Correct? Okay. So at this time, we are still up at we're still 406,000. 406,821 to the good for 2025.
So that doesn't impact, did we budget any excess revenue to different lines for next year? We didn't. Okay. So we're in good shape. Okay. Great. Any other questions? Thank you. Thanks for being here and answering our questions and giving a good report. And we got the WIC update. So Dr. V.
So for the next hour.
He's been waiting to say that.
No, I'm just kidding. I have a recommendation, which is I can defer my presentation. If I may call your attention to two items that are in your packet, then we'll get review those in January. December the 27th is International Day of Epidemic Preparedness, which we're observing. And one of our team members from Emergency Preparedness, Rebecca McMullen, drafted a great op-ed that we hope will go in the paper in December. We're encouraging our teams to write more so we can share information. That's number one. And number two, in your packet, you have this summary, which is the after action summary of our measles response that was extremely successful in the region, knock on wood, hopefully we'll stay that way. Has a lot of data, and in January, and then I can go into some of the detail, because it will be worth looking at the various systems, processes, and tools that we have developed over the last couple of years to be prepared and to be able to respond quickly and without hesitation. So I think it's worth looking at in January, if that's okay with the chair.
Wow, this looks like a really thorough, explanation of how you went about trying to isolate anyone who would have been exposed and treat. And it's a good example of a whole epidemiological process.
Thank you. And the team has developed a lot of tools. I can tell you, other jurisdictions are mimicking what we do, and we've shared many of the tools that we've developed, because we do really have an extremely good response and response time for the size of the jurisdiction. So, but we'll talk about it in January in more detail.
Wonderful. Thank you. Okay, Kim, did you have anything that needed to be covered? We're good? All right, wonderful. Okay, then is there any other board member updates?
I do. I just want to reiterate that I went to the training for culturally specific treatment of opioid use disorder with the city yesterday. And what I found interesting about it that I'll leave people with is that there were questions about what culturally specific meant. And the city in the grant process was leaving that open to the applicants to provide to them whatever definition that they found useful. Some of the discussion was about the Slavic community not being able to get particular treatment because of their own reticence to seek treatment and so on. But I just thought that was very interesting and something for people to think about. And also I wanted to encourage the public to go out and apply for this money. It's $500,000. There weren't very many people in attendance, and there's always a problem with when you're providing these grants, reaching people who apply and they have such a short window. So I just wanted to put that little spiel out there in collaboration with the city.
Can I say something real quick?
Yes, thanks, Patricia. Yes, Charlie.
All right. So just want to let you know, I don't know if this is a proper way to do this or not, but if this happens to be my last board meeting, just wanted to say that I've served the board for 4 years. I've had the honor and privilege to do so. It's an amazing experience, and I believe that I've done some good things to affect the change. Still on the fence if I'm going to reapply again for another 2 years, but I am swaying to probably giving another individual the privilege and the honor that I've had to take my seat. So if you see me in the applications, that's probably because I'm like, hey, let's do it again. But other than that, thank you guys for everything, and I appreciate it.
Thank you very much, Charlie, for all your service. Really appreciate it. And maybe we'll see you in January. But if not, we will see you in the community. So thank you. All right. Any other updates? All right. Seeing none, we will adjourn. And I've very much appreciated being chair, but I'm happy to hand over the gavel in January. So thank you. Have a great day.